The first batch of the coronavirus vaccine created by Pfizer and BioNTec have arrived on UK shores today in unmarked trucks. Plans continue for the first NHS workers to be immunised next week. Under the pandemic conditions, approvals have been fast-tracked, but not without public concern about the effects of the vaccine.
At last, the vaccine, long hoped for, is in England. It may not be in these lorries, but we've confirmed that it's arrived and is making its way to the devolved nations. Next comes the complicated question of delivery. The details are still being sorted, but everyone in the NHS agrees it won't be easy.
We know that there are huge workforce shortages. We know that demand is through the roof across every part of the NHS at the moment, with coronavirus, with winter illnesses. You know, it's a very stretching time, but I think everyone's prepared to put their shoulder to the wheel because this is the rollout of a vaccine, which is the route through coronavirus.
On the street in London, there was excitement and some caution.
Absolutely, just so that we can live and go back to just being normal. So obviously it's there to help. So yeah, definitely, I would definitely take it.
Oh, 100%, I can't wait.
It's madness not to. Absolute madness.
I don't think it's been given enough time to see if there is any after effects. I know they said you get a temperature, but I think that we should wait a little bit longer to see if there's any more lasting effects.
The issue of time has also been raised in Europe and the US, where critics have questioned the decision to license the Pfizer vaccine so quickly.
They go deeper in the data at European Medical Agency than with the UK emergency authorization. And I think it's better to go a bit deeper because we are vaccinating healthy people.
Here's where the decision to license the Pfizer vaccine was made. The headquarters of the UK regulator, the MHRA.
Like all regulators, the MHRA changed its process to make sure it can approve the vaccine as quickly as possible. But even if you do that, you've still got to be quick off the mark. Yesterday, I was on a call with Pfizer executives, and they were asked how come the MHRA had been so speedy. They said, well, we don't know for sure, but when we emailed them, they got back to us within 10 minutes.
One ex-regulator says it's entirely possible to be fast and accurate.
They've been looking at it since June. It's not new to them. They've been talking with the regulators ask the companies questions, and very often there is a clock running when questions are asked, but the clock is measured in days, not in minutes. And at the moment, under the pandemic conditions, the MHRA have been able to prioritise assessment of the vaccine in the way that they won't be able to do so necessarily in the future.
While they were developing their vaccine, the team at Pfizer had a motto: science will win. It's far too soon to say that it has, but at last, victory does seem possible.